Hi, this is Dr. Roy Kim. I wanted to do a quick recap of my trip to DGBT, which stands for Deutsche Gesellschaft Botulinum Therapie. Now, having said that, I don't know German, so if I completely have butchered this actual pronunciation, it's totally on me. DGBT is one of Germany's oldest and largest conferences that's really geared towards originally Botox, but they've opened it up to fillers, to other neuromodulators, to all medical devices that are lasers, energy devices that really relate to dermatology, aesthetic skincare, as well as the med spas. I was honored to be a guest speaker, and they asked me to talk about the differences from the US versus the German markets in those specific areas. I'll be talking briefly about what I discussed, as well as what I learned there in Germany. First of all, I do think that the US and German markets are 95% the same or maybe even higher. I think some of the generic differences are, in the US, we are very med spa driven. There are a lot of nurse injectors. Of course, there are overall doctors and medical directors, but we are driven by med spas. In Germany, it's very much driven by doctors, specifically dermatologists and plastic surgeons and some aesthetic doctors. It is really not driven by large med spa chains or med spas in general, and it's also really not driven by nurses or nurse injectors at all. There's also a difference in terms of age, as well as how aggressive the patients want different results. In the US, interestingly enough, we actually skew younger in the Botox, neuromodulator, filler, and energy device fields. They have common injectables, common medical devices. The lasers are the same. They're made by the same companies. There are some subtle differences. First off, America has Daxxify, which is a longer lasting Botox alternative. Should last about 6 months. Germany doesn't have it yet. What's interesting is that Germany does have Galderma's Relfydess product. This product is an injectable that's a Botox competitor that should also last about 6 months. Galderma's Relfydess should be approved soon for the US market. Nobody knows exactly when, and I'm looking forward to trying it out. The nice thing about being in Germany is that they told me a couple secrets about their use of Relfydess. Number one, it's actually pre-mixed, so it comes in liquid form. Number two, it actually stings a little because of the lower pH with injection. There are a couple ways to help with this. They're all off-label, of course, and it remains to be seen if these hints will actually work. And to be honest, anecdotally, this is what I heard from the German doctors who have used that product. It'll be interesting to see if the same holds true for the United States. There's a product that we have in the US that no longer is available in Germany. It's called Bellafill, which is a PMMA microsphere combination. It's a filler that lasts about 60 months, which is 5 years. What's interesting in the US is that it's a pretty uncommon filler. Germany and the United States did have an earlier version called Artifill or Articol, and they had to pull it from the market in Germany. It's no longer being sold in the United States. They just never got around to actually getting the improved version, what we call Bellafill, back into Germany. Finally, I mentioned this briefly in the past, but Allergan is awaiting FDA approval for TrenibotE. This is a unique Botox type neuromodulator that works just like Botox, except it kicks in a couple hours and it lasts about 2 to 3 weeks. I discussed at DGBT that they're really looking at a 3-part market. Something that kicks in very quickly and doesn't last that long. The normal stuff that we all know and love, including Botox, Xeomin, Dysport, and others like it. And finally, the longer lasting market, which is America's Daxxify and Germany's Galderma's Relfydess. It'll be very interesting to see how this market sort of plays out in both countries. Regarding medical devices, there is one US device that does not exist in Germany yet. It's called Ellacor. So what Ellacor is, it cores out small, tiny slivers of actual tissue, physically removes them, and your underlying tissue sort of shrinks around the cores that are now missing. It's used to help remove scars, it's used on the face, and interestingly, Ellacor actually got indication for use on the body. Germany does not have a single device like this, so I discussed the technology as well as the overall results. Germany does have skin boosters. In the US, we only really have Skinvive, which is an Allergan product that's dilute or reconstituted HA. Germany has like a ton. They have a lot of different products, including the salmon sperm DNA, Regeron, as well as other chemicals. Germany by far has like 6-10 products, something like that, in the skin booster area. There really aren't any differences in the lasers available. And finally, Germany does have the Agnes Medical Double Tight. Double Tight is a dual function device. Number one, it's a machine-driven skin booster. And number two, it's actually RF microneedling. Agnes Medical has been unable far to get FDA approval for this product. If it does get FDA approved, it's really, to me, a game changer. I've heard very good things about my friends who've used it outside the United States and in Korea, and they really love the efficiency and the speed as well as the results of this product. In Germany, the patients definitely skew older. I spoke to a lot of my German colleagues. A lot of their patients really don't believe in sunscreen, which is very surprising. Now, they were joking because they said Germany doesn't really get that much sun. But having said that, they know the powers of sunscreen, and a lot of patients in general simply never use it. When I was walking around, I noticed that I thought that more Germans smoke compared to the US, and actually I'm proven right. In terms of tobacco, the rate of smoking in the US is just about 10% or a little below that among adults. In Germany, they don't really know, but they estimate it's 20 to 30% of adults, which seems awfully high to me. This does not include vaping. They think in both countries, vaping is pretty high. And as you know, who cares about lung cancer? As a plastic surgeon, I care about whether you're a candidate for surgery as well as wrinkles on your face. Okay, just kidding. Smoking obviously is bad for your lungs. Lung cancer is a bigger problem. But obviously, if you smoke or vape a lot, you can develop wrinkles at an earlier age, or your middle-age wrinkles look worse. And this seems to be what's happening in Germany, at least to the doctors I spoke to. Of course, I love art. In Berlin, I was able to go see the actual Queen Nefertiti bust. And correct my pronunciation if I'm wrong. It's called the Neuss or New Museum. Of course, since I don't know German, I don't know how to pronounce it. But you could only take photographs from a very great distance. They don't really allow photographs like really close to about 20, 30 feet. But I'll be making a separate video on Queen Nefertiti and her influence on, of course, the Nefertiti lift. While in Germany, of course, I was able to meet with old friends and make new friends, which was a lot of fun. And they actually dragged me out to Wiener Schnitzel 3 times. Just in case you don't know it, Wiener Schnitzel, of course, is like deep fried, beaten down, flattened veal or other types of meat. It's very delicious, it's just it's deep fried. The other thing which was really big in Berlin right now, Germany in particular, is spargel, which of course I'll probably mispronounce it. It's the same asparagus that we have in the United States. However, they grow it sort of under dirt. It's not really exposed that much or at all to the sun. It doesn't turn green, it remains white. Also, typically in Germany, it's pretty big. Like it's literally twice as big as the green asparagus that we see in the United States. It has, to me, a slightly lesser taste. Yes, it tastes like asparagus, but maybe 50% less. And it has the same awesome diuretic effect. And just in case you don't know, you may have to look it up. The next DGBT conference is in 2 years. I look forward to seeing you there. And in the meantime, we're going to keep on going with learning about Botox, fillers, neuromodulators, medical devices, and so forth. Thanks again for the invitation to speak to DGBT and especially the president this year, Dr. Saeed Hilton. It was a lot of fun. And if you like this video, you can watch this other video on skincare, on neuromodulators, and other fun things. If you have any questions, leave them below. And as always, thanks so much for watching.